And I actually tore a tendon in here and had to have it surgically repaired. And the advice that we're going to give you is to prevent this from ever happening.
Hey everyone, on this next video, we're gonna show you everything you need to know about tennis elbow just from A to Z in 5 minutes. How cool is that? My name is Dr. Todd Pickman from Gonstead Spine and Wellness out here in Meridian, Idaho. If you haven't subscribed to our channel yet here on YouTube, please take a second, go ahead and hit the subscribe button, turn on your notifications so you can be in the loop of all of our new content that comes out every single week. Now, before we get started, let me just tell you a little bit about this video we're gonna cut into. It's something we filmed, 4 or 5 years ago for a program called Move Well in the Workplace. And it's great content, so I decided to share it with you again here today, but I wanted to explain what this is. And it's about a 5-minute video where we talk about tennis elbow. It gives you a lot of understanding as far as how this develops, why this is such a problem that plagues us today, and how to address it in an effective way, even at home, and when to know if there's red flags and you need to get checked out by a qualified healthcare practitioner, AKA chiropractor, such as us or our group of doctors that we work with. Side note, we serve 2 audiences. One is our patients and our community here in Idaho and those that want to travel in to see us. We have patients that drive in and fly in to see us. It's pretty awesome. And the second audience that we take care of are chiropractors. We teach chiropractors how to integrate their practice with corrective exercise, functional movement, and how to take these awesome systems that we do here in our clinic and bring them to their clinic to take care of patients all around the country, all around the world. Okay, with that said, we're gonna cut away, check out this video. I'll see you back in a few minutes.
In this video, we're going to talk about a very common condition in the elbow called tennis elbow. And I want to differentiate first. You don't have to play tennis to get tennis elbow. This is something that will happen to the outside. You can see I actually have a nice little scar here because I had really bad tennis elbow for years of bodybuilding, and I actually tore a tendon in here and had to have it surgically repaired. And the advice that we're going to give you is to prevent this from ever happening, okay? So the stuff that I know now is stuff that I did not apply for my own well-being several years ago. So tennis elbow, there's 2 bones here. There's the radius, which is on the thumb side, and there's the ulna, which is on the bottom side. The ulna, and inside here, that's the funny bone area that you can hit. There's a nerve that runs in here. So now what can happen is that with tennis elbow, the radius can misalign. That's one thing that can happen. It can be a joint alignment issue, and that necessitates someone who's trained in extremity adjusting. That's something that in our clinic we do quite intensively. And so you can adjust the radius. But now, in addition, the interesting thing with tennis elbow is it's usually an imbalance between your flexors, which are these muscles that cause your wrist to flex, and your extensors, which cause your wrist to go back the other direction. There should be a balance, and most of us, if you had to guess, do you think we're extensor dominant or flexor dominant? We are flexor dominant. We're typing on a keyboard, we're grabbing stuff, we're gripping stuff. We're always flexing our flexors, and our extensors in comparison are weak. And so if they're weak and they're deconditioned, then they are more prone to injury. And what happens is the tissue on the front side of the forearm, it's very taut and tight, and it pulls into the tendon and where the tendon inserts into the elbow. It causes inflammation in here, lots of issues, lots of pain. It could even hurt to pick up a glass of water when someone has such a bad tennis elbow. So now, how do you address this? Well, one is making sure the alignment of the elbow is in place, making sure nerve supply from the spine and the neck is working properly, but some quick fixes that we're going to include after this video, working on some of the musculature in the forearm. We can do that with a lacrosse ball. We can pin and stretch the tissue, and I like doing that with a lacrosse ball technique that we're going to show in a following video. And then also too, strengthening some of these muscles as long as it doesn't create any pain. So if you can strengthen these extensor muscles, typically opening the fingers against resistance, you can put a rubber band on the outside of the fingers and just open against resistance like this. Do that about 10 repetitions, both sides, until you start to feel it burn a little bit in here. That means you're activating these muscles firing. Kind of shows you how inactive or weak these muscles can be. And that's a way to start strengthening these muscles so there's more of a balance between the flexors and extensors. Now, I wouldn't do that if you're in the acute stage, meaning if you're hurting a ton, you don't want to be doing something that creates pain. Icing initially is going to be very important in this as well. And the goal is not to overwork it and let it get to the point where it actually tears. The typical medical approach, they give corticosteroid injections like Kenalog and lidocaine and different things, corticosteroids, cortisone. The issue with that, it weakens the tendon, and where the tendon inserts to the bone, it can actually tear. And I'll just divulge something in my health history. Is years ago when I had this, I was at my wit's end and I was really just stubborn, and I kept bodybuilding and I wanted to get back into the gym. And I had a friend who's an orthopedic surgeon. He gave me a shot of Kenalog in here. Pain went away, and instead of rehabilitating it and following the advice that I'm giving you, I kept training on it. I tore it and had to have it surgically pinned back in place because it weakened from the injection of Kenalog. You can probably guess I'm not a huge fan of getting corticosteroid injections. There's a lot of conservative things you can do before it gets to that point. You also see little bands out there that you can use for tennis elbow. And the purpose of the band is what that does is it essentially takes the muscle that goes from here to the hand, and it creates a new origin, okay, of that muscle where that band is, if that makes sense. When it clamps it down, it basically gives the space on the other side of the band a chance to rest so that these tissues can actually allow some of the inflammation to come down, and then this muscle's still functional without tugging on this long muscle, this long string that goes from the elbow to the fingers. So those bands are very helpful. They're to be used temporarily during the acute stage, and you want to make sure you're not doing anything that further aggravates this issue. So if you have pain and you're doing activities that cause more pain, you're going to keep this thing chronically inflamed. It's never going to heal. One last thing I want to differentiate, golfer elbow is medial epicondylitis. It's on the inside. So it's everything that I'm saying the same, but on the inner side of the elbow, there's a similar approach for that. Tennis elbow or lateral epicondylitis is typically more common. And again, you don't have to play tennis or play golf to have either one of these, but I hope this video helps give you some insight of how to look at tennis elbow issues.
Okay, what did you think? Pretty comprehensive, right? Leave some comments below. Let us know what else you want us to cover. If you have any questions about this topic specifically, comment and tell us if you've had tennis elbow, what you've done, what's been helpful. Make sure you check out our other videos where we go into lots of stuff on tennis elbow, as far as the worst exercise you can possibly do, the one that did me in, because remember I had tennis elbow. I got the scar, got the battle wound to prove it. Plus, we talk about what you can do, the best exercises to get to the root of this nagging problem. Again, Dr. Todd Pickman from Gonstead Spine and Wellness. When it comes to the health of you and your family, results matter most.